Welcome to the Ascension St. Vincent Joint Replacement Solutions education class. My name is Chris Johnston and I'm the coordinator for the joint replacement program. We're going to give you some information that will help you with being better prepared for your upcoming surgery and with what to expect along the way. Let's get started. What we're going to go over are the things you need to do to prepare for your surgery, what to expect while you're in the hospital. We'll talk about some complications that you need to be aware of following surgery, and we're also going to talk about a few things you need to be doing once you're back home after surgery. Hopefully you received the joint replacement guidebook from the surgeon's office. It has a blue cover like the ones you see in the picture here. If you have one, please pause the slideshow now and get yours, as we will be referring to some page numbers as we go along. If you did not receive a guidebook, you can get one from your surgeon's office, or you can pick one up at the Ascension St. Vincent Orthopedic Hospital. There are separate books for knee and hip replacements, so make sure the one that you get corresponds to the joint you're having replaced. And we do encourage you to read through that book thoroughly. There is a lot of good information there that will help you with getting better prepared along the way. And we do want you to bring that book with you to the hospital when you have your surgery, as they will be using that during the therapy sessions you'll have. Now, if you would turn to page 8 of that guidebook, and that starts a checklist of some things that goes through page 14 in just making sure you're getting things better prepared at home and with the things the surgeons want you to do before surgery. So as you go along the next few weeks getting ready for your surgery, make sure you're looking at those checklists from time to time and making sure you're getting things done that they want you to do. And if you would turn to page 18 of the guidebook, there is a list of some things there that help make getting around your house safer and easier for you once you're back home after surgery. We do want you to take a good look at that book before surgery. If you have things that need to be done, it is always a good idea to get those things taken care of before surgery. So that way, when you're heading home following surgery, you're going to walk into a house that's ready for you. And then the very next page, page 19, that is where the exercises start. So we do want you doing these exercises before surgery, which are the exact same exercises you're going to be doing right after surgery. But the purpose of doing those before surgery is that any strength you can gain before surgery makes the recovery process easier and faster for you after surgery. If you have not already been doing these exercises, I would highly encourage you to get started on them, because it will make a big difference in how things go for you afterwards. And you've got the list of exercises to follow on that page there. They want you to do the exercises twice a day if you can manage it. And most of the exercises, they do want you doing 20 repetitions. If you cannot do twice a day, if you can't do 20 repetitions to begin with, start with whatever you can tolerate. And even if that's just a few repetitions, it is still better than doing nothing at all. And the pages that follow, you probably have 8 or 9 pages worth of pictures and descriptions of all the exercises there. They are very self-explanatory. The book does a good job with it. But if you're working on these and you're having some difficulty figuring out how to do something, please give me a call. I will give you all of my contact information later on. But it's pretty easy to walk people through these over the phone if you need a little bit of help with something. And also be aware that the exercises are supposed to be done on the leg you will be having your surgery done on. And do not get onto the floor to do your exercises. That can cause trouble for you, especially after surgery. So when you're doing your exercises at home, use a bed, a sofa, the recliner. They are all much better places than getting onto that floor. Another big part of what we do with our program is we like to get our coaches involved. So coaches are the people that are going to be helping you out after surgery, which are typically family and friends. But the more we can get everybody involved along the way with all of this, it is going to make things a lot safer and easier for everybody once you get back home after surgery. Hopefully it will make the process a lot smoother. So we do want the coaches to look through the materials you have. We also want them involved in what happens during your hospital stay as well, because the more information that can be passed along is going to make things a little bit easier for everybody once you get back home too. So coaches, be involved in this process as much as you can be. Here is a list of medical equipment that may be helpful. You likely will not need all of this equipment, but the one thing all patients need is the rolling walker, like the one shown in the picture. If you already have a walker, make sure to bring it with you on the day of surgery. If you don't already have a walker, we will get one for you the day after surgery. For those of you who are patients of Dr. Lee or Dr. Tim Hamby, you will need to get a walker from their tri-state orthopedic office prior to surgery, since you will likely be going home on the day of surgery. There is also information on page 15 of the guidebook on how to size up and use your walker. The sock aid and reacher are only needed for those patients who are having posterior hip replacements, those who are patients of Dr. Boyd, Dr. Saltzman, Dr. Lee, Dr. Tim Hamby, Dr. Zach Hamby, and Dr. Kelly, as you will have to follow some positioning precautions after surgery, and these will assist you with those restrictions. Those who are having anterior hip replacements with Dr. Knoll, Dr. Rinsing, and Dr. Whitney do not need the sock aid or reacher, as you do not have to follow any positioning precautions. Also, knee replacements do not need sock aids or reachers either. The other items on the list from sponge on down are up to you and what you need at home, so they are not required, but they may be helpful. It's good to think about the height of your toilet though. If you have a standard height toilet, you may want to consider a commode extender, which gives you extra height to make getting up and down easier. If you have a taller toilet already, you do not need a commode extender. And the shower tub seat is more of a safety concern to help minimize the risk of a fall on a slick floor or to keep you from having to stand for long periods of time. Of all the items that are on this list, the only one typically covered by insurance is the walker. This means the other items usually have to be paid for out of pocket. If you need any of the other items, you can usually find them at stores like Target, Walmart, CVS, Amazon, or even Goodwill. It is a good idea to get any equipment you need prior to surgery though. Here we have some other things you need to do prior to surgery. If you have difficulty with constipation, it's a good idea to try to manage this well prior to surgery, as one of the big side effects of opioid pain medication is constipation. So start increasing fluid and fiber intake prior to surgery and begin taking stool softeners such as Miralax or Dulcolax as directed on the packaging, so you don't end up with constipation problems after surgery. You will also not be allowed to shave, wax, or nair your legs for 5 days prior to surgery, as this is an infection risk concern and could cause cancellation of your surgery. If you do these things within that time frame, they likely will postpone your surgery even if you do not have an infection. So make sure to follow these instructions. And over the next few weeks before you have your surgery, please report any health issues to your surgeon, no matter how big or small of a problem you might think it is. They may be able to treat the problem so you can still have your surgery as scheduled, but if they do need to postpone surgery, it's easier for everybody to know about it in advance. And on the day of surgery, you will have a hospital gown on, but the day after surgery, we'll get you changed into your own clothes. So please pack a bag and bring some clothes with you. Typically would prefer shorts, baggy pants, and t-shirts. The reason for this is that you'll be out in the hallways doing your walking and doing therapy sessions, and nobody really wants to do that very badly when you have your rear end hanging out the back of a hospital gown. Also bring a list of current medications that you are taking, prescription medication, over-the-counter medication, vitamins, or herbal supplements. The list needs to include the information you see underlined on the screen, so do not bring your actual medications, just bring the list with you. And if you have sleep apnea and use a CPAP or a BiPAP machine, please bring yours with you from home and bring that along with you when you check in for your surgery, as they'll put it on you in the recovery room following surgery to speed up your recovery, and you can also use this while you're in the hospital. So now you finally arrived at the hospital on the day of your surgery. Once you're all prepped and ready to go for surgery, you'll be taken to the operating room. The type of anesthesia you get is determined by your surgeon. Dr. Boyd uses spinal injections for his patients, while all other surgeons use regional nerve blocks. Along with either one of these, you will also get general anesthesia, which is what will put you to sleep. Once surgery is finished, you'll be taken to the recovery room. You likely will have x-rays taken while you're there, and usually within a couple of hours, you are doing well and they take you up to the nursing unit. For those of you who are Dr. Lee or Dr. Tim Hamby patients, you very likely will go home on the day of surgery as long as you recover well following surgery. Please be aware of this and be prepared. All other surgeons have their patients spend at least one night in the hospital. Once you get to the nursing floor, pain management becomes a priority. If you are hurting, it will affect how you can do your therapy, so please let the nursing staff know if you need anything, whether it's for pain or something else. Our nursing staff is fantastic, so please do not hesitate to hit the call light if you have any needs. A little later on the day of surgery, most patients will get out of bed and get moving a little bit. This could involve getting up to go sit in your recliner or using the restroom, but there's also a good chance you'll see physical therapy staff to go for a short walk or even go for a walk with the nursing staff a little bit later in the evening. We're also a non-smoking facility, so you're not allowed to go outside and smoke. If you need a nicotine patch, your nursing staff can help you with that. This is your daily schedule while you're in the hospital. It starts the day after surgery and will be your daily routine for however long you're in the hospital for. Wake up time is around 5 o'clock in the morning. They will have you get dressed in your own clothes for the day and out of your bed and in your chair ready for breakfast by no later than 7:30. Around 8 o'clock in the morning, your therapy sessions will start up. All of your therapy will be done one-on-one in your room with the therapy staff. You will have sessions with physical therapy to work on exercises and with occupational therapy to work on activities of daily living and self-care. We also encourage your coaches to be involved during your hospital stay as much as they're able to be. There will be a lot of information provided by nursing staff and therapy staff that will be helpful for everyone once you get back home. Your discharge day depends on who your surgeon is, how you do with your therapy, and if you're having any medical issues. Dr. Lee and Dr. Tim Hamby usually discharge their patients home on the day of surgery. Dr. Boyd knee replacements will typically have a 2-night stay in the hospital. All other patients are generally going to go home the day after surgery. Your surgeon will discuss your discharge plan with you, so please be aware of the plan and have your arrangements made. Once you are discharged from the hospital, most patients will go directly home, which is the preferred place to go. Knee replacement patients will be doing outpatient physical therapy sessions as directed by your surgeon. Some surgeons also have their hip replacements do outpatient therapy sessions as well, while other surgeons just have their hip replacements do their exercises on their own at home out of the guidebook. Please consult with your surgeon on their plan for you. We also have a social worker that will assist you with your discharge planning. If you're unable to go directly home following your hospital stay, she can look into facilities that you could go to for a short stay, or if you need help with getting transportation to your outpatient therapy sessions, she can help arrange for that. And if you have questions regarding medical equipment or financial assistance, she can also help with those things. The phone number you see on the screen is the direct phone number for our social worker, so please call her if you have any questions, but she will also stop by your room the day after surgery to speak with you. Now we're going to talk about the complications you need to be aware of after surgery. These are low-risk problems and are unlikely to happen, but these are definitely things you need to know about, so please be aware of the preventative measures and the signs and symptoms we'll discuss here. If you do get home after surgery and think you have a problem, we encourage you to contact your surgeon first unless it's an emergency situation. But if you are having difficulty getting in touch with your surgeon quickly, you should go to a convenient care, family physician, or the emergency room to get checked out. Some complications have potential to somewhat quickly progress into worse situations, so it's important to get seen by a physician promptly if you have concerns. But we do prefer that you try to get in touch with your surgeon first if you're able to. If blood clots do happen, they will typically occur in a vein in your lower leg, but can happen in the groin area, which is not nearly as common. The blood clot blocks blood from escaping your leg, so that means the leg will start to swell up fairly big and usually will become painful at some point. It won't matter how much you ice, rest, or elevate your leg, since the swelling cannot escape until the blood clot is treated. If you're at home after surgery and think you may have a blood clot going on, a good way to check for that is to lay your leg out flat and then have somebody bend your foot and ankle back towards your chest. If you have a clot, you will feel some fairly significant discomfort in the back of your knee or the top part of your calf muscle. This is a good indicator you have a blood clot, so go get that checked out right away. Also be aware that clots can form in either leg, so if you start to notice signs and symptoms in the opposite leg, please make sure to get that looked at as well. A pulmonary embolism occurs when a blood clot breaks free from wherever it was created and then travels to your lungs. This is an emergency situation and is potentially life-threatening and could result in death. If you think this is happening, go directly to the emergency room. Do not go to a convenient care or call your surgeon. One of the big dangers with these is that they are sometimes rapidly developing situations and must be treated quickly before they turn into life-threatening situations. Signs and symptoms are detailed here, so please be aware of them and get to the emergency room quickly if you have any concerns that you have a pulmonary embolism. In order to help prevent blood clots from happening, your nursing staff will be telling you to do ankle pumps while you're laying in bed following surgery. This is basically just moving your feet up and down, which is going to help get the muscles working to get the blood circulating around a little bit better to help prevent blood clots. Early ambulation means getting you moving fairly quickly after surgery, so you're not just sitting around and letting blood stagnate and create clots. So you will do some walking while you're in the hospital, and once you're back home following surgery, we encourage patients to get up every 2 to 3 hours to do a little bit of a walking to help get that blood moving around a little bit better. You will also be wearing TED hose for 2 weeks following surgery, which are the thick, tight nylons that go from your toes to your hips. You'll be given these at the hospital, and you will have those on both legs. You will also be taking blood thinners in some form or fashion for a period of time after surgery. Your surgeon will determine what type of blood thinner is right for you, so please follow the instructions that nursing staff will give you about taking your blood thinners. And if you're unsure if you have a blood clot or any type of complication following surgery, please get things checked out right away. Oftentimes, delaying treatment for even a day can turn something pretty minor into something that is going to cause a lot bigger trouble for you. So please let the doctors decide and don't put off seeing somebody if you think you have a problem going on. Infection is probably the biggest concern following surgery, so please pay close attention to the signs and symptoms that are listed here. You are going to have some pain and swelling after surgery from the surgery itself, but we'll have a good idea of what's normal and what's not by about 48 to 72 hours after surgery. If you start developing sharp increases in your pain or heavy increases in swelling that don't seem normal or don't seem like they're related to too much activity, these could definitely be concerns. And also watch out for your hallmark signs of infection. Pay attention to any kind of red, hot, or inflamed areas that might develop around your incision area, and also pay attention to any changes you may notice in the color or odor of the drainage you may have on your bandaging. Most patients will leave the hospital with just a small amount of drainage, which should decrease with time. But if you are home for a few days or longer and notice that your drainage is not slowing or begins to increase, this could be a sign of infection as well. And if you develop a fever that goes over 101 degrees at any time for any reason, no matter what you think is causing the fever, you need to see a doctor fairly quickly to determine if you need to take antibiotics. The concern is that there are general illnesses caused by bacteria, and some types of bacteria, if they get into the bloodstream, can settle in areas with implants and create an infection. This is a real risk, and this is something you must be aware of for the rest of your life. To help with preventing infection, you'll be given instructions on using some antibacterial soap for showering for 2 days prior to surgery, which gets bacteria off your skin and reduces infection risk. The details for the showering are given on page 17 of your guidebook, so please follow those instructions closely. The underlying things are pretty simple things that help make a pretty big difference in avoiding infection. Make sure you wash your hands well before doing dressing changes, before eating, and after any kind of restroom use. Daily bathing will get bacteria off your skin and keep it away from your incision area, and also practice good oral hygiene for the rest of your life. So see your dentist for regular checkups and brush your teeth daily to keep bacteria out of your mouth. Make sure you follow the instructions that the nursing staff will give you about doing dressing changes after surgery. All of our surgeons use waterproof dressings following surgery that do not need to be changed frequently, so please don't stock up on a bunch of dressing change supplies prior to surgery that you likely will not need. We've already talked a good bit about getting quick attention to any concerns about health issues you may have, so please don't put any concerns off. Let the doctors decide on things. And if you haven't had any kind of dental checkups done within the last year, it is encouraged to do so before surgery, as it's possible you can have infections in your mouth that you aren't even aware are there. So your dentist can identify these concerns and treat them prior to surgery. You will not be allowed to do any kind of dental visits or invasive procedures for 100 days after surgery. And once you are allowed to resume doing dental visits, you will need to take antibiotics prior to visits. And there are also some dentists who have you take antibiotics after visits as well. And you have to do that for at least the first 2 years after surgery. But I would say most dentists and most surgeons will recommend doing this for the rest of your life. And the reason for that is that dental procedures, including cleanings, can introduce bacteria from your mouth into your bloodstream, which could result in an infected hip or knee. It's a good idea to contact your dentist prior to surgery to make them aware you're having a joint replacement done, and they will explain that process to you. During your surgery evaluation center visit, they swabbed your nose out to see if you were colonized with staph bacteria, which can live in your nose and on your skin. If you test positive for staph, you will receive a phone call with instructions on how to treat for staph prior to surgery. This is called decolonizing, which gets the staph off you before surgery and helps to prevent infection. The instructions for this decolonizing are given on page 16 of your guidebook. If you get the phone call that you've tested positive, please follow the instructions carefully. This information is only for those having posterior hip replacements. Those having knee replacements or anterior hip replacements with Dr. Knoll, Dr. Rinsing, or Dr. Whitney do not need to follow these instructions and can disregard these precautions. These precautions are detailed on page 41 and 42 of your hip guidebooks, but an easier way to remember these is with the TLC seen on this slide. It's a good idea to be familiar with these and practice these prior to surgery, as not following these precautions could lead to disruption of the healing of the muscles from your surgery and could potentially lead to dislocating your hip. These restrictions are temporary and usually only have to be followed for about 3 to 4 weeks after surgery, so they are not lifelong. Eventually, you will be able to get back to doing everything normally. Your physical therapist will also review these with you during your hospital stay and will also provide you with some tips on how to accomplish tasks easier while still following your restrictions. Your surgeon will let you know when you can resume normal activities. You'll be prescribed pain medication following surgery. It typically is prescribed for you to take it every 4 hours, but if you don't need it every 4 hours, we don't want you to take it every 4 hours, as that can lead to over-medicating or even overdosing. But also don't be stubborn about taking it. Many people don't like taking it, but if you're hurting, you won't do as well with your exercises and it will slow down your recovery. So don't try to tough it out. Use it if you need it. And if you develop side effects from your pain medications, such as upset stomach, out of control pain, fuzzy head, dizziness, itchiness, whatever it may be, contact your surgeon's office. They can switch it to something different. Also, make sure to time out your pain medication doses so you can get a dose in at least a half an hour prior to any therapy, as it will allow it to get into your system to take the edge off your pain so you can do better with your exercises. And never take your pain medication on an empty stomach, as this can lead to upset stomach and possibly GI bleeds. Make sure to eat a little bit of food before you take your pain medication. And make sure to get ice on your incision area frequently too. That will help with controlling pain and swelling. You will be given instructions on an icing regimen while you're in the hospital, and you will not be allowed to put any kind of heat on your incision area until your surgeon clears you to do so. So no hot packs, hot tubs, or bathtubs until you are told otherwise. There is a risk of addiction with taking opioid pain medications, which are the strong ones that most patients will start with after surgery. They are usually necessary, but we also want you to limit the amount you take as much as you're able to due to this addiction concern. On the screen is a list of things that are helpful in managing your pain without having to pop pills all the time. It's largely distraction technique activities to keep your mind off of your pain. Try some of these out to see what may work for you. You will also reach a point where you feel ready to get off the strong pain medications. And when you feel like you're ready for this, talk to your surgeon about non-narcotic options of pain medication that you can take that will help with managing your pain, but do not have the concerns of addiction or side effects like the opioid medications. You also have a higher risk of becoming addicted to opioids if you fall into any of the categories that you see listed here. Another thing that happens with taking opioids is they depress your respiratory system. So if you already have a compromised respiratory system due to things like sleep apnea, COPD, asthma, or emphysema, there is a slightly increased risk of overdose. So please be cautious about the way you take your pain medication. Whatever opioid pain medication you're prescribed after surgery should not be mixed with other opioids you already have at home, as this leads to a stacking effect that could potentially lead to an overdose. On the screen is a list of common medications that contain opioids. If you have already been taking these before surgery, do not mix them with what you were prescribed after surgery. The other things on the list from alcohol on down also depress the respiratory system. If you mix these with your pain medication, it further depresses your respiratory system and could potentially lead to an overdose as well. If you have any questions about what you can take along with your pain medication, please talk with a doctor or pharmacist about it first. Do not take the chance of mixing things together and putting yourself at risk for an overdose. Constipation is a big concern following surgery because of the opioid pain medications. So the nursing staff will be going over a bowel regimen with you while you're in the hospital, which you need to follow for as long as you take your pain medications. You should increase your fluid and fiber intake, so please try to drink 64 ounces of water per day and eat fiber-rich foods. And the nursing staff will also give you instructions on the use of stool softeners. If you get home following surgery and are following your bowel regimen but are still having trouble with constipation, please get in touch with your family doctor to get some advice from them before you end up with a bowel obstruction, which is a dangerous thing that will put you back in the hospital. Once you're home after surgery, we don't want you sleeping all the time during the day, as this can lead to blood clots from inactivity and likely also means you're not doing your therapy like you're supposed to. Also, follow any restrictions that your surgeon may place on you. Everyone will have driving restrictions for a period of time, and posterior hip replacements will have position precautions to follow, but in general, you're allowed to resume normal activities as you feel like you can tolerate them. Please be patient and use common sense. Don't try to rush things too much and cause a setback for yourself. Make sure you keep doing your daily exercises and your daily walking as instructed once you're back home, and try to avoid high impact activities such as running, jumping, jogging as much as possible for the rest of your life, as this type of heavy pounding can cause the implant to loosen from the bone, damage the bone, or damage the implant. These type of things put you back in surgery much sooner than you'd like. If you are interested in exercise classes, please check out local gyms and senior centers that are located near you to see what is offered. Pool therapy is a popular choice, and there are also Silver Sneakers classes offered in different locations as well. The reason pool therapy is helpful is that being in the water takes up your weight-bearing load and makes things more comfortable for you, and water resistance also provides a great strengthening workout. These workouts can be modified to be as easy as hard as you want them to be. However, you will not be allowed to put your incision area underwater for any amount of time until your surgeon clears you to do so. This is an infection risk concern. So this means no getting into the pool, bathtub, or hot tub until you are told otherwise. You will be allowed to return to showering fairly soon after you get discharged from the hospital. The nursing staff will give you instructions about showering, so please follow what they tell you. If you would like to know how the surgery is done, you can search the internet for surgery videos. If you don't want to see the real surgery, there are also animated versions of surgery, which are cartoonish and provide you with a good idea of what happens in surgery without giving the detail of the real surgery that some people don't want to see. And here is my contact information. This can also be found on page 1 of your guidebook. Please feel free to contact me before or after surgery if you have any questions or concerns about anything. I'll be glad to help you with whatever you might need. I hope you found this information helpful. Thank you for your time and enjoy the rest of your day.